Hello, my name is Cornelis van Tilburg. I'm a pediatric oncologist from the Kids in Heidelberg, Germany, and I will present to you our abstract about the pediatric precision oncology study INFORM. Next slide, please. So as a background, children with refractory, relapsed and progressive high-risk malignancies have a very poor survival, and the INFORM study evaluates the clinical potential of precision oncology in children by identifying molecular targets for treatment, like off-label treatments, but also for the identification of potential biomarkers for enrollment in clinical trials or development of clinical trials. And last but not least, it provides additional diagnostic precision for patients. So INFORM gives children a chance to benefit from off-label therapy, sometimes from adult oncology, targeted drugs, and enrollment in biomarker-driven clinical trials. And this is the first time actually that such a large precision oncology platform and pediatric oncology was assessed for its clinical benefit. Next slide, please. So how did it work? The 8 countries above in the corner participated in the study. They could send a sample to the kids in Heidelberg for molecular analysis. After the analysis was performed, the results were discussed in a molecular tumor board, which took place online and was also participated by the treating pediatric oncologist of the patient. The board evaluated targets according to a predefined algorithm with a 7-step scale ranging from very high to very low priority target levels. And this was depicted in an online data bank, which was accessible by the treating physician, and the treating physician could make clinical decisions on the basis of the reported alterations. This is important. The INFORM study is not a clinical trial. After the clinical decisions, the patients were treated with maybe a targeted drug or sometimes also by conventional therapy, and the clinical follow-up was depicted in the database again. And today we will present to you the clinical outcome of those patients. Next slide, please. So to start with the outcome, in this analysis, 526 children were included, and 149 of them received matching targeted drugs. The left-hand panel in green are the patients depicted with who received matching targeted drugs, and compared to the patients on the right in red who didn't receive matching targeted drug. And you can appreciate that in the patients which received matching targeted drugs, that they had more very high and moderate level priorities compared to the patients who didn't receive matching targeted drugs, which had more lower priority target levels, and even also a significant proportion of patients didn't have a target. So apparently physicians used our algorithm for clinical decision making. 17 children were included in clinical trials. 40 children were identified with potential cancer predisposition syndromes, and their families were offered human genetic counseling. And lastly, in approximately 8% of the brain tumors, we were able to provide diagnostic refinement of the original diagnosis. Next slide, please. So this is the most important slide of my presentation. In the left-hand panel, you see the progression-free survival for, in red, all patients who received matching targeted drugs, and in blue, who didn't receive matching targeted drugs. And as you can see, the curves overlap. But if you go to the highest priority level, the very high priority level targets, and analyze them separately, you clearly can see that those patients who had a very high priority level target and received matching drug had a median PFS of 204 days, which is longer as all other children who had 114 days. Next slide, please. So in conclusion, pediatric precision oncology in a real world, in a realistic time frame, in a multinational setting is feasible, and very high priority level targets are identified by INFORM, provided therapeutic opportunities for subgroups of children. And also new diagnostic information could be offered to children and families, like the predisposition syndromes or the diagnostic refinements in brain tumors. And as an outlook, there's an urgent need for biomarker-driven pediatric interventional clinical trials. And also a significant group of patients didn't have very high level targets, and we should put our efforts in adding additional layers of diagnostics for them to also let them benefit of new treatments. Next slide, please. On behalf of the INFORM Consortium, I would like to thank all the patients and their families, our funding sources, German Cancer Aid, German Childhood Oncology Foundation, Ein Herz für Kinder Foundation, German Cancer Consortium, all our cooperation partners, and last but not least, the Conquer Cancer ESCO Foundation for selecting our abstract for the James B. Nachman Award. Thank you very much for your attention.